at the Women's Health Program, we work on a variety of things, whether it's back pain related to current pregnancy or post-pregnancy. We can work on that. Hip pain, anything going on with the pelvis, in addition to all of the pelvic floor diagnoses. So any kind of urinary incontinence, fecal incontinence, pelvic organ prolapse, or even pelvic pain. So a variety of diagnoses, kind of running the gamut from pain to constipation to pelvic floor.
We have 2 private treatment rooms that are designed. We have one specifically designed for women's health. It's a very comfortable space where these women can come and have their privacy, receive excellent care, and feel comfortable. That was very important to us, so we wanted to build that space.
And even if on that first day, you don't want to do some of the more invasive treatments, we can start with something else. There are always other orthopedic things that we can look at, patient education topics to talk about, and when you're comfortable, we'll move on to those types of things.
First, I was extremely nervous because I had no idea what was coming for me. I didn't know what was going to be happening. I didn't know if I was going to actually get an exam or not. And I did end up getting an exam that day. And what really shocked me the most was how many questions I was asked, and in depth.
We really have the time to devote to each patient in order to do those extra things like patient education, really explaining the nature of their symptoms, how we're going to address it, have the time to address it, and then also take them through exercise and just give them that one-on-one attention that they really need and deserve.
So I had come in here initially for pelvic floor, and then just telling Dr. Anna oh, and I have these issues, and I have these issues, and I have those, and I don't really know why I'm experiencing pain in all of these areas. And even though some of them aren't because of my pelvic floor, I'm sure that my pelvic floor has a small impact on them, but there's some things that weren't a part of that. She just took care of me as a whole, as an entire system, if you will. And she didn't just look at the one thing that I came here for. She ended up treating me for everything that I've ever had an issue with, that I've seen all these different specialists for. I'm just coming to one doctor for, which is pretty amazing and pretty helpful, I would say.
So something that I really want every woman to know is that as we go through life, there are a lot of changes that we go through. And just because something is new, it's not necessarily, and it might be common, but it's not necessarily, it doesn't have to be your new norm.
I've learned how much your pelvic floor can impact the rest of your body. And in doing pelvic floor therapy, I can actually feel where all of my other pain is coming from. My knee pain and even my hip pain, it's far more than just where your pelvic floor is. And it's relieved so much of my pain. I don't I don't have nearly as many spasms as I used to. I don't have nearly as much pain in my hips as I used to, none of that. It's almost like it's kind of started to cure me in a way.
We really enjoy providing people or our patients with that patient education before performing any type of manual technique or any type of exercise. Because if they don't truly understand how to do the exercise or why it's benefiting them, or if we're performing cupping therapy or dry needling, they might not totally get the full experience. I want them to understand how we're trying to help and what it's doing for their body, so that they're excited to come in for their next visit, and they're excited to try maybe a different service, or they're excited to hit that new goal in the gym, and they understand why. And they also can start to understand and figure out how to help themselves further, because at the end of the day, the best tool we can give them is for them understanding how to help themselves and maintain that over a length of time.
For the first time in my life, I was finally getting answers and not looked at like I was crazy. So I would say definitely after my first appointment, I immediately called my mom and was like, I think we just figured it out. I think we finally have the answers now. I was pretty happy.
So we really work together to take care of women through preconception, pregnancy, and postpartum. And I think that's why we're so effective, because we can take you through that whole process. And whether you're a year out from getting pregnant or you're 5 years from having your last baby, we're here for you.
If you're interested in experiencing any of the wide variety of services that we provide and that we offer, we encourage you to give us a call at 814-528-5667. We also have an option on our website for you to fill out an inquiry form where we can get back to you via email or phone call ourselves. and even just questions are welcome. If you want to call, tell us a little bit about what's going on and ask a couple questions, we can have one of our therapists sit and chat with you for a little bit. That's always an option if you're on the fence about getting really started or committed to physical therapy.